sites of origin and multiple sites of insertion, but all of them have an origin and an insertion. Skeletal muscles only pull, they never push, right? So that even when it appears like you're pushing, that's muscular contraction, shortening. And during a contraction, a skeletal muscle insertion moves towards the origin. And so biceps inserts to the radius, so that when biceps contracts, it pulls the radius towards the origin of biceps, right? Okay, cool. So muscles may be classified into various morphologic types based on the fiber or fascicle organization, and they are given descriptive names based on size, shape, position, attachments, depth, etc. Ah, good stuff. Power is back. Please fire that up. Yeah. So I recommend you read for basic understanding of the principles we're discussing, yeah? I recommend you read Essentials of Anatomy and Physiology by Elaine Maria. It's there in the mega folder, right? It's a very straightforward book. It answers most of your questions, and those questions it doesn't answer, you can bring to me in class, right? But it will satisfy most of your curiosity. And then, because it lays down principles, then the practicals will flesh out your understanding of gross anatomy, of morphologic anatomy. And then on the side, we're going to discuss development and microscopic anatomy. Please bring it into focus. Called quadrilateral. We have strap-like muscles, and strap-like muscles can be continuous, or they can have tendinous intersections. And then we have muscles that have dilated bellies and narrow tendons. Such muscles are called fusiform muscles. We have digastric muscles that have two bellies with an intervening tendon. And then we can name muscles based on the number of heads of origin. And so in this case, this muscle has 3 heads of origin. Some muscles are triangular, some are cruciate. These bits we can skip, they won't help you much. I think this is the important stuff, yeah? So we name muscles based on their shape. Triangular muscles are named deltoid. You remember the Greek letter delta, right? Capital delta is a triangle. Square muscles are named quadratus, quadrilateral, quadrates. Diamond-shaped muscles are named rhomboids, and we have rhomboid major and minor in the back. Round muscles are named teres, and you'll meet many teres. There is teres major and teres minor in the shoulder region. There's a muscle of the forearm called pronator teres. Slender muscles, and there's only one that is named gracilis, are named gracilis. Straight muscles are named rectus, rectus abdominis, rectus femoris, superior rectus in the orbit, inferior rectus, medial lateral rectus. All that means is the muscles are straight. And then worm-like muscles are named lumbricals, right? So when you guys learn about roundworms, you learn that they are called ascaris lumbricoides, yes? All right, so lumbrical refers to worm-like. Muscles can be named by their size. So when you have 2 muscles in the same region and one is bigger than the other, then the bigger one is called major and the smaller one is called minor. So for example, in the pectoral region, you have pectoralis major and pectoralis minor. Sometimes the term is maximus, medius, and minimus. Maximus for the biggest, medius for in between, minimus for smallest, right? And in the gluteal region, you have a gluteus maximus, medius, and minimus. Long muscles are named longus. So for example, there's a long muscle in the neck that is called longus colli. The term colli refers to the neck. Short muscles are named brevis, right? Adductor pollicis brevis. Yeah, so, okay. Adductor pulls the thumb medially. Pollicis, the pollex, brevis, it is the short one. So short muscles are called brevis. You'll meet a few that are named that way. Broad muscles, so the term lata refers to broad, right? So you'll meet a fascia lata in the thigh. That refers to a broad fascia. Now the broadest of the muscles is called latissimus, right? And latissimus is found in the dorsal part of the body, and so it is called latissimus dorsi, right? All these terms are derived from Latin. So those of you who have some familiarity with French, might find that some of these terms are familiar. And then you can name muscles based on the number of heads or bellies. A muscle that has 2 heads of origin is called biceps, and so you have a biceps in the thigh, biceps femoris, biceps in the arm, biceps brachii, right? The arm is called the brachium, the thigh is the femoral region. Muscles with 3 heads are named triceps, triceps brachii, triceps surae. Muscles with 4 heads are named quadriceps. So the term CEP, C-E-P, refers to the cephalus, right? Cep means head, and so bicep, right? Tricep, quadricep. So it means 2 heads, 3 heads, and 4 heads. So quadriceps femoris, for example, is a muscle with 4 heads in the thigh. A muscle with 2 bellies is named digastric. Gasta refers to stomach. Yeah, you guys remember Drosophila? Yes, and that particular Drosophila had a black belly, and so it was named Drosophila melanogaster, black belly. All right, we can describe muscles based on their depth relative to the skin. So when you have 2 muscles doing the same function, for example, in the forearm, you have 2 muscles that perform this function. This is flexion of the fingers. And you have 2 muscles that perform digital flexion. One is close to the skin, the other is deep. The one close to the skin is called flexor digitorum superficialis, and the other is called flexor digitorum profundus, to mean deep. Right? So you know how people who speak wisdom are called? Profound, right? Yeah, and that term means they are deep. So the Latin is actually for depth, right? And you'll find that term profundus repeated multiple times to refer to a deep structure relative to a superficial structure. When you have 2 muscles and one is external and the other is internal relative to a bone or relative to the skin, then one will be called externus and the other will be called internus. So for example, you guys are familiar with the obturator foramen? Okay, this is the obturator foramen. It's on the pelvis, between the ischium, pubis, between the ischium and the pubis. And there's a muscle that arises off this outer surface, and another one arises from the inner surface, right? Because they both arise from the margins of the obturator foramen. Both muscles are called obturator, but one is called obturator internus, and the other is called obturator externus. And then you can name muscles based on their attachments. So the muscle sternocleidomastoid in the neck is attached to the sternum. It is attached to the clavicle, and the term clavis refers in Latin to a key. The Greek for clavis is kleido, right? And so we call it sternocleido, and it attaches to the mastoid process of the temporal bone. And so sternocleidomastoid. There is a muscle in the arm that arises from the coracoid process of the scapula, and that muscle is called coracobrachialis. Brachialis because it inserts to the long bone of the arm. And then you can name them based on their position: anterior, posterior, medial, lateral, superior, inferior. Superior rectus, inferior rectus. One above the eyeball, one below the eyeball. Scalenus anterior, scalenus posterior muscles in the neck. One is anterior to the other one. Muscles between the bones are called the interossi. So an os is a bone. So a muscle between 2 bones occupies the interosseous position. And so, for example, between the metacarpal of the thumb and the metacarpal of the index finger is a muscle called the first dorsal interosseous. We talked about this. So the latissimus, the broadest muscle of the back, is called latissimus dorsi. The straight muscle of the abdomen is called rectus abdominis, right? The big muscle of the pectoral region is called pectoralis major, and the small one is called pectoralis minor. The bicipital muscle of the arm is called biceps brachii, and the tricipital muscle is called triceps brachii. The quadricipital muscle of the thigh is called quadriceps Femoris. The bicipital muscle of the thigh is called biceps femoris. Right?
Yeah.
Now, the muscles related to the mouth all carry, okay, not all of them, but there's a particular muscle that circumscribes the mouth, right? It orbits the oris. Yeah, so the mouth is the oral cavity, in Latin oris, ora. And so the muscle circumscribing the oris is called the orbicularis oris. And a muscle circumscribing the eye, going all the way around the eye, is then the orbicularis oculi. And then you can name muscles based on their function. Extensor or flexor. So extensor digitorum, flexor digitorum. One extends the digits, one flexes the digits. Abductor, abductor and adductor. One moves an appendage away from the midline, one brings it back. Levator raises and depressor lowers. And so you have a levator scapulae that does this, right? And you have a depressor anguli oris. It depresses the angle of the oris, and so it does this. Yeah, that muscle that pulls those edges down. Supination is a movement that presents the palm anteriorly, while pronation presents the dorsum. The muscle responsible for supination is called supinator. The muscle responsible for pronation is called pronator. And then a muscle that dilates, that constricts an opening is called a constrictor, and a muscle that dilates an opening is called a dilator. And so, for example, in the pupil, you have a constrictor pupillae that reduces the aperture of the pupil. And at the same time, you have a dilator pupillae that increases the aperture of the pupil. In the pharynx, you have muscles that regulate the caliber or the diameter of the pharynx, the superior, middle, and inferior constrictor muscles. Right? And so we name muscles for various reasons: shape, size, number of heads or bellies, depth, attachment, position, and action. Now, muscles can act in a number of ways across the joint. You guys read chapter 1 of Serebnik, the Hungarian guy. Did you guys read the whole of chapter 1? Do you remember the Hungarian guy? The guy who introduced anatomy to us. Alright, so I hope you read the whole of chapter 1, because we are finishing what's left. So muscles can act in a number of ways across a joint. The prime mover is the muscle that causes an action. Opposing the prime mover is a muscle called an antagonist, and an antagonist performs the opposite action. For an action to be possible, the prime mover is activated and the antagonist is inactivated. And then you have muscles called synergists that support the prime mover in its movements. Synergists can do the same thing as the prime mover. And so, for example, in flexion of the shoulder, right? And flexion of the shoulder is movement of the humerus anteriorly relative to a coronal plane. In flexion of the shoulder, the prime mover is pectoralis major, right? And so it pulls the shoulder, it pulls on the humerus and drags it anteriorly. But biceps brachii has a role in moving the humerus anteriorly. Coracobrachialis has a role in moving the humerus anteriorly. Deltoid has a role in moving the humerus anteriorly. And so those muscles act as synergists of the prime mover. They work together with it. Other synergists do not perform the same movement as the prime mover. Instead, they eliminate other possible movements so that the prime mover can act unopposed. So they stabilize the joint. Now, the glenohumeral joint has a big head and a very shallow. It has a big ball and a very shallow socket, right? And it's unlike the hip joint because the hip joint has a deep socket. And so at the glenohumeral joint, you need muscles that pull the head of the humerus into the socket of the scapula before movements are possible. And muscles that perform that function of anchoring the two articular surfaces to one another are called fixators. You have fixators in the thigh and you have fixators in the shoulder joint. And we're going to talk about what those muscles are. Now, different types of movements. Any questions so far? Are we like together? Yes, or is it Friday?
Yes.
All right. So different types of movements occur across joints courtesy of muscle action. So we have a movement called flexion, right? Who is able to describe flexion for us? Yes.
Bending from the medial, when you bend the part of the body from the medial
Yes.
section is when you bend the part of the body from the medial.
So from this one. Okay, but flexion is parallel to the median plane. It doesn't interact with it because it doesn't actually cross it. Yeah. Okay, have I made sense? So the median plane is over here and the plane of flexion is over here. So they're actually parallel to one another. Yeah? Alright. But good attempt, yeah? Would you like to modify it? So it's not this plane, it's this one, right? Yes. And so flexion occurs when an appendage moves anteriorly relative to the mid-coronal plane, right? The plane that occupies the coronal suture. And this is true in most cases. So digital flexion, right? Elbow flexion, shoulder flexion, flexion of the neck, flexion of the trunk, right? All those occur when you cross that coronal plane anterior, right? Flexion of the hip. This is that part of the class where I stand on things, and I like it. So this is flexion of the hip, right? My hip has moved anteriorly relative to a coronal plane. Make sense? Right? Okay, so what then is flexion at the knee? And so flexion at the knee is the opposite direction. Right? So flexion at the knee occurs in the opposite direction. And so that voids the rule we've just established. Right? Or it's a modification to that rule. And so we can improve our definition of flexion by saying that flexion is any movement that reduces the angle between a segment and the vertical. Right? And so when I move, if you assume like there's a vertical plane over there, when I move my elbow in flexion, I have reduced that angle. Right? And what extension does is extension increases that angle. At the hip, this is the angle, and when I move my hip in flexion, I have reduced that angle, right? When I move it in extension, which is the posterior movement, like that, I have increased that angle. Does that make sense? Right? And so again, I am reducing the angle, I am increasing the angle, right? Okay. And so what is this movement?
Extension.
No, in the trunk, this is not abduction and adduction. That movement is actually lateral flexion of the spine, right? And so the spine is capable of lateral flexion. It can move, it can deflect in both directions across the median plane. So we call that lateral flexion, all right? What is plantar flexion? And what is dorsiflexion? Yes. Stand on something and show us. Simama hapo lakini usianguke kama ule msee. Ama ukuje usimame hapa.
This is plantar flexion, the movement of the feet.
Bwana simama hapa. Bika. Chungmalo. Kijaluo imeisha. Niongeze. All right, and what is adduction? And that is adduction, right? In the hip, this is abduction, and that is adduction, right? All right, is there anywhere else where abduction and adduction are interesting? No, that's all right, okay. So we've done flexion, extension. What is medial and lateral rotation? So for reference, you can just go back to that chapter 1 that we used to discuss our introduction, right? He describes medial and lateral rotation. So what is medial and lateral rotation? Pom pom pom.
So, medial rotation is when you are turning the upper thing that is towards the medial.
All right. So you rotate it so that the palm faces medially, right? Or in the lower limb, you rotate the hip. So you're rotating at the shoulder and at the hip. You rotate at the hip so that the toes point inward, right? And so that is medial rotation. The opposite is lateral rotation. So that when you rotate this to face that way, and when you rotate the toes to point outward, that movement is described as lateral rotation, right? Okay. And then you have side-to-side rotation in the neck and in the spine. We've talked about adduction and abduction. You guys can go figure out what circumduction is, right? It's a conjugate movement. And then we can talk about inversion, eversion, supination, and pronation. Yeah? So inversion and eversion occur. So the ankle joint includes maybe 3 or 4 articular surfaces. And inversion occurs and eversion occur at some of the articular surfaces of the ankle joint. There's a joint called the subtalar joint. Now at the subtalar joint, it's possible to rotate the foot on its long axis, right? So that you point the soles of your feet medially, right? Some people like to stand like this. When I was young, I used to stand like this a lot, right? Now that movement is called inversion, where the soles of your feet face each other. When the soles of your feet face outward, that movement is called eversion. All right? Inversion is a more possible movement than eversion. Eversion typically results in dislocations and sprains of the ankle joint. Supination and pronation concern rotation of the radius and the axis of the radius and the ulna over one another. And typically, what's happening, so the ulna is the medial bone, and the radius rides over the ulna to present the dorsum, and it rides back to present the palm of the hand. When you present the palm, that movement is called supination. When you present the dorsum, that movement is called pronation. All right? And I think that about brings it to an end, right? And so muscles are also named for the movements they cause, right? And we mentioned that already. So the muscle groups of the body are things we will become familiar with in the course of our practicals and the rest of this presentation. So the rest of the presentation includes a specific discussion of the bones, a specific discussion of muscles, and blood vessels of the upper and lower limbs. Those are things that we are going to achieve in the course of